When was the last time you went to the dentist? Depending on where you live, the most painful part of the process may have been seeing the price tag. If you can relate to this, don't worry, you aren't alone. And you're not crazy. Dental work is expensive. These days, even the most basic dental procedures can be quite costly. Dental fillings can range from more than $100 to nearly $300 a piece, depending on the size of the filling, while more invasive and time-consuming procedures like a crown or molar root canal go for about $1,000 per tooth. One reason for these high costs is that the materials used on our teeth don't come cheap. And really, ask yourself, would you want cheap materials going on your teeth in the first place? The material cost of your dental implant or crown is probably more than half the total fee. Those little tiny pieces of plastic are quite often not plastic, and are instead very expensive materials that cost a lot to source, shape, sanitize, and prepare to be permanently fixed in your mouth. There are also a lot of extra materials required, such as filling materials, polishing paste, adhesives, drill bits, impression materials, and much more. Chances are, if a product costs a lot, it's because it's of extremely high quality. The tools at a general dentistry practice include highly specialized equipment that is not only pricey to purchase, but also to maintain. Film X-ray machines cost more than $20,000, and newer digital machines go for $10,000 to $15,000 more. That lovely, or maybe terrifying, reclining dentist chair costs about $30,000. This, of course, doesn't take into account the costs of other surgical tools, as well as the anesthesia and other medications used in procedures such as root canals and fillings. Then, there's the cost of changing technology. A reliable and competent dentist will always invest in the best equipment. Have you noticed how much X-ray technology has changed? That stuff is shockingly expensive, but dentists cannot do their jobs without it. Almost all dentists have a hygienist on staff. And unlike many other medical professions, there are almost always two people working on you at all times, your dentist and his or her assistant, which adds to the cost of your visit. To practice dentistry, you'll need more than just a room to rent. Each practice requires a small operating theater with a comprehensive setup involved, including plumbing and special fittings. Think of all those bits and bobs that the dentist needs, such as crowns, veneers, bridges, dentures, splints, mouthguards, even whitening trays. These are all made at a dental lab by a dental prosthetist or a dental technician. The lab will also require a fee to complete their services, and this has to be passed on to the patient. That's you. Yet, tools, drugs, and lab work aren't even the most costly part of doing business for minty dental professionals. Dentists, like all other doctors and healthcare providers, must carry a large amount of malpractice insurance to operate. For example, a dental surgeon in California has to pay malpractice insurance costs between $22,000 to $34,000 per year. All these factors contribute to the high costs of visiting the dentist. If you're lucky, you have dental insurance to help mitigate these costs. But the best way to avoid costly dental procedures is to take good preventative care of your teeth.